Howdy folks, in this video I want to talk about the phrase, first do no harm. In my last video I talked about the Hippocratic Oath. I went through it line by line and assessed how good it is ethically speaking. Now I mentioned that the thing that the Hippocratic Oath is most famous for, the phrase, first do no harm, doesn't actually appear in the original Hippocratic Oath. It actually was inserted sometime in the 19th century. The phrase, first do no harm, is mentioned all the time by physicians and other people commenting on bioethics. And many people take it to be extremely powerful and action guiding, that above all else, we shouldn't harm people. And that on its face seems like a pretty reasonable thing to believe. In this video though, I want to do the very philosopher thing of asking, what do we really mean by do no harm, and is it actually as helpful as we think it is? The most obvious thing about the phrase, first do no harm, is that it's meant to be an absolute rule. When people say do no harm, they don't mean that that can be outweighed in some cases, that, in some cases it's okay to cause harm, depends on the circumstances. Instead, what they mean is that it is an absolute point that no matter what, you cannot cause harm to somebody else. And this is what gives it its force. This is what gives it its strength, even in cases where it might be tempting to do so, where there might be these other considerations. We're still not allowed to cause harm. In this way, it is like the phrase, thou shalt not kill. That doesn't mean like killing is sometimes okay. It means you can't kill anybody. That is the whole point of it. But this raises the really important question about what does it mean to say that we can't do harm? I think that there are a few options, and I'm just going to walk through them one by one. If we take the phrase do no harm literally, it means that in no circumstance can a physician cause harm to a patient. But this literal interpretation is clearly unworkable. So just think about all of the situations where physicians either accidentally cause somebody harm through a mistake or a side effect, or they purposefully cause somebody harm, but that harm is outweighed by other things. So think about a physician prescribing you a drug. They give you the drug and they say, look, this drug is going to help you, but there are going to be these side effects. Now those side effects are harms, that they are things that are unwanted that are going to make you worse off in certain ways. Or think about a physician who performs a C-section. She takes a scalpel and she cuts through the person's skin into the uterus to remove a baby. Now, that act of cutting into somebody and then sewing them up afterwards, that is a harm. Ideally, if there were a way to remove the baby without having to do all the cutting, that would be much better. It's just that that action is justified because it's the best kind of consideration, all things considered. But there are clearly harms involved. There's a long recovery process to recover from a C-section. And so the person is being harmed. It's just that there are benefits that outweigh those harms. So if you think about this interpretation of it, do no harm means you can never cause harm, that physicians would basically not be able to do anything, that any drug that they prescribe to you, any intervention that they want to perform, if they have to set a bone so that it heals better and it's extremely painful to do that, they're causing you harm, they're causing you pain. And none of those things would be permitted if we take do no harm as the literal interpretation of it. So obviously that's not going to work. We have to look elsewhere. If the literal interpretation is not going to work, then we need to think about some other options. The problem with the literal interpretation is that it says that you can never cause harm, but we saw that there are cases where it's clearly justified to cause harm as long as the benefits outweigh the harm. So one of the other alternatives that we could appeal to is just that it's permissible to cause harm as long as the benefits outweigh the harms. Or to go even further, and this is my preferred interpretation, doctors should just maximize patients' well-being. They should do whatever is going to produce the most well-being or the most benefit overall. And that's the best way to think about it. The advantage of this approach is that it nicely captures all of those cases I described before. A C-section is justified if the benefits are going to outweigh the harms or if it's going to be the best result overall. And that's what would make it ethically permissible. Similarly, if a doctor is trying to decide whether to prescribe a medication or not, then the doctor should think about what is going to produce the most well-being for the patient, or what is going to produce the greatest kind of difference between the benefits and the harms, and then they should choose the medication that's going to maximize the benefits. So that gets all that right. The downside of taking this approach is that it loses the sort of force as an absolute rule that the original interpretation gave us. So it's no longer possible to appeal to never doing harm. Now we have to weigh the pros and the cons of an intervention. So to see one implication of this, consider a condition called body integrity identity disorder. When patients have this, they experience that some part of their body, such as a limb, doesn't belong to them anymore. The author Oliver Sacks wrote a book about his experience with this condition. And in his case, he experienced that his leg was no longer part of his body. People who have this condition, it's really rare, but people who get it will sometimes go to great lengths to have the limb removed. They'll go to the doctor and they'll try to see if the doctor will amputate it. Or in some cases, tragically, they'll try to amputate it themselves, and predictably that can be really bad for them. So the question is whether it's ever ethically permissible to amputate a limb, knowing that the limb itself is fine, there's nothing wrong with the limb, rather it's some kind of like processing issue going on with the brain. And there's a debate about this in bioethics. So Arthur Caplan, who's one of the most famous bioethicists around, he once said that it's absolute utter lunacy to go along with a request to maim somebody. So he thinks that in every case of body integrity identity disorder, what the person really needs is some therapy or some other kind of treatment, and doing the amputation would always be wrong. But I think that this is actually kind of trying to have it both ways. I think that the issue with that interpretation is that there are going to be situations, or like imagine that there could be situations, there's some evidence that this is true, that removing the limb does actually solve the problem. So there are some small studies that have found that that in about 50% of the cases that removing the limb does actually kind of make the problem go away. So if that's possible, and suppose that we could know with confidence that there would be cases where removing the limb would be better, then it's hard to justify why it would always be wrong to do the amputation. That if amputation is always wrong, that because it causes harm, then it seems like that is sacrificing the patient's own well-being or overall well-being for the sake of protecting that healthy limb. But what we should care about is not just like how healthy limbs are, we should care about overall the patient's well-being. So I think that taking that approach, going back to the kind of original do no harm interpretation, I think it just gets it wrong in some situations, such as body integrity identity disorder. Unfortunately, there are other problems with the interpretation of just maximizing well-being. So I can think of two of them. One of them is that there are going to be cases where actions clearly don't maximize well-being for the patient, and yet they're still ethically justified. So imagine that I want to donate my kidney to somebody else. If I donate my kidney, they're going to like cut into my body, take out my kidney. The health implications of that, it's actually like, there's a recovery process, like the length of life is about the same, but there could be complications. Removing my kidney is clearly not maximizing my well-being. The reason to remove my kidney is to help somebody else. But if we think that every action that a physician performs has to maximize the well-being of the patients involved, all of the patients involved, then clearly that's not going to allow kidney donation. I think that just produces the wrong answer. The second problem is that maximizing well-being puts more power in the hands of physicians and less power in the hands of patients if it's up to the physician to decide what constitutes harm or not. So in a situation where there's a disagreement between the patient and the physician about whether something is a harm or whether something is an acceptable harm, as in the case of body integrity identity disorder, that this approach gives the power to the physicians to be able to make that decision. But if the patient has decision-making capacity, then they should have the autonomous right to make their own decisions about healthcare and other sorts of things in their lives. So I think that in this way as well, that it just kind of focuses on the wrong thing. We should be focusing on the autonomy of patients and what they want, and less on kind of some like objective standard about what well-being is. So I think the conclusion that we should reach is that harm is something physicians obviously should be avoiding, that causing harm to people is wrong. But I think a phrase like just do no harm, that trying to package so much into one kind of pithy statement is actually not that helpful. Thank you everybody for watching this video. I appreciate it. Please like and subscribe, and I'll see you in the next one. You can't do no harm. You can't do no harm.